Okay, today we're going to talk about light therapy. And light therapy is a really important part of the program. And the first day we talked about diet and nutrition, talked about healthy organic food, we talked about food is a source of all life. We need good nutritious food because the good nutritious food has electrons. And we need electrons into our body. Now, the sun is the source of all life. There's a process called photosynthesis that when the sunlight hits a plant, there's a process, photochemical process that takes place where the light, the photons, are converted into energy. And in a plant, there's something called chlorophyll. And chlorophyll is the reactive element where the photons go into the plant and they convert it into food. So we're taking electrons from the sun and putting that into our food. So one of the best ways to get electrons into your body, and we talked about, an alkaline state, is to eat good, healthy, organic food. As soon as you eat food that's cooked and preserved, it destroys its nutritional value. Now I'm going to tell you something really interesting. In the human body, we have something called hemoglobin. And hemoglobin is what makes the blood red. It's also a reactive element. The hemoglobin carries energy in our body. Now, if I was to show you a chlorophyll molecule, project it right here, and a hemoglobin molecule right next to each other, you'd look at it and say, Dr. Kondrot, they're identical. And indeed, the molecules are identical except for one element. Does anybody know what that one element is that makes chlorophyll different from hemoglobin?
Light? Light, the sunlight?
Well, the element is in hemoglobin, it's iron in the center. And in chlorophyll, it's magnesium. Otherwise, the molecules are different. So essentially, we are like walking plants. And so when we go outside and the sunlight hits our skin, our tiny capillaries, we're actually absorbing the sunlight. And there's that process coming in. So when I talk about light therapy, we do light therapy in various different ways. All of you have had the syntonic light therapy. Syntonic light therapy is when you look through this device here, and we have a non-coherent light source. By non-coherent, it's like a light bulb. A light bulb scatters light energy. So the photons hit your eye. And this is a very powerful therapy because when your eyes are open, your retina is transparent. So the light actually penetrates into your blood. When an eye doctor looks into your eye with his little light, he can actually see your blood vessels. He sees the red blood. So this treatment, that light that's coming in, is impregnating every hemoglobin molecule, and it's causing a marked physiological reaction in your body. Light has an effect on the atomic level. Because we use spectrophotometry, certain light frequencies will vibrate an individual element. Also, light has a biological effect. Studies have been done to show that when light hits into the cell, something called cytochrome A absorbs the photon, and it begins a process called the electron transport chain, converts light into energy. Also, we know that light has an amazing ability in terms of our neuroendocrine system in our body. Seasonal affective disorder, the circadian rhythm, making sure we get a good night's sleep, etc. And light has a profound effect on the autonomic nervous system. You can quickly balance your autonomic nervous system depending on what light frequencies you're exposed to. So this simple light therapy has many, many profound effects on your body. So when you're doing the light therapy, realize that it's not just the boring activity looking at the light. Now, we're also doing laser therapy. Laser therapy using the delta laser. Where is the delta laser? Somebody has it. I need the delta laser. And we're also using something called the Thor laser. And the Thor laser here is a coherent light. It's a powerful light source that's coherent. By coherent, the light rays are lined up in a coherent manner. And the delta laser is another laser that we use. So I first became interested in using laser treatment for the eye when there was an article published out of Germany demonstrating that red infrared light had a profound effect on improving folks that have macular degeneration and also glaucoma. So when I read the article, I purchased this laser so I could duplicate the experiment. And I think I mentioned the other day that usually when I buy a new piece of equipment, I test it on myself first, and then I test it on my wife before I start treating patients. So my wife and I were playing around with this, and when she was shining it into her eye, she said, "Honey, this is just like looking at the sun." And immediately a light bulb, upon a joke, a light bulb went off. That the work of Dr. Bates. Dr. Bates was a turn-of-the-century ophthalmologist who practiced alternative medicine, and he felt that sunning was a very valuable thing to do to help improve the health of your eyes. And Dr. Bates advised you that you sit and watch the setting sun or the rising sun, close your eyes and turn your head back and forth, and you'll see the image of the sun. So essentially, when you're doing this light therapy, it's kind of like sunning. And if you think about it, when the sun is rising and it's setting, it's red infrared. It's the same wavelength that's produced with this laser. So you don't have to buy a $16,000 Thor laser, which we paid for it. You can simply, if you live in an area where you have a nice, beautiful sunset or sunrise, you can do the sunning. There was another study done that demonstrated the effectiveness of doing light therapy to your eye, where they did an experiment with mice, and they subjected these mice to exposure to light, expose their retinas to light, and then they put these mice into toxic environments, hypothermia, hyperthermia, toxic environments, and they measured the damage to the retina. And they determined that pre-treatment with light decreased the damage to the retina. So, we're constantly being exposed to toxins in our environment. So light therapy is something remarkable that we can do to improve the health of your retina, energize the retina, neurohormonal factors, all these things. Now, the big question, is there a difference between coherent light and non-coherent light? So that question was studied by a brilliant Russian, Dr. Tina Karu, and I met Dr. Karu, and she has a research lab in Moscow where she investigates light. So she did an experiment measuring the effect of light on the cellular level, looking at coherent, a light bulb, versus non-coherent, a laser. And guess what her results showed? There's no difference. A photon is a photon. The difference is the following. When you're doing a laser, it has deeper penetration. The intensity, the power is greater, has deeper penetration. So if I have a knee problem and I want light therapy, maybe non-coherent light is not going to be effective. But the coherent light, and interestingly, many alternative doctors, laser therapy is one of the hottest topics in alternative medicine. Physical therapists are using, dentists are using it, for musculoskeletal problems. It's widely used, light therapy. So one of my goals was to try to find a reasonably priced laser that had an effective treatment. So obviously, the Thor laser, which is excellent, but at $16,000 is kind of out of the price range of most people. And that's when we discovered the Delta laser. This is under $2,000, and the Delta laser is kind of interesting. Not only does it have syntonic light, the non-coherent light, it has a red infrared light. It also has magnetic energy. When we talked about magnetic energy, the force field of the Earth, and it also has ultrasound, some sound frequencies. So it has 4 modalities in one. And research has shown when you combine these modalities, you get a greater effect. That's one of the reasons why I have all of you do light therapy and microcurrent. Not at the same time, but you're doing it during the day. It does have a synergistic effect, and I think it has an additive effect. But this is one device that can be very effective if you're interested in adding light therapy to your practice. Now, all of you here have glaucoma, and if I would say to you, next time you go back to your eye doctor and talk to your glaucoma specialist, ask him, can light therapy help my glaucoma? So what do you think he would say? You had to have visited Dr. Kondrot in Florida, or are you crazy? But believe it or not, in 1948, in the journal, the American Journal of Ophthalmology, which is our prestigious journal, there were 2 articles published that demonstrated certain wavelengths of green light can lower the intraocular pressure. And of course, green light is the balancer of the autonomic nervous system. You have red, which represents the sympathetic, blue, the parasympathetic. Green is in the middle. So we want all light therapy to get you in the balance. Of course, green light is what helps balance your autonomic nervous system. So this article demonstrated the effectiveness of certain frequencies of green light. And I'm not suggesting that everybody wear green glasses, because the problem is your autonomic nervous system is imbalanced. So if you're on the red side, the sympathetic, you need more blue. If you're on the blue side, you need more red. So there's a fluctuation that occurs. In fact, it occurs constantly. You know, when you're under stress, you go onto the red side. When you're really relaxed, meditation, you're on the blue side. There's a constant dynamic. But light therapy has been shown to balance out autonomic nervous system and help with glaucoma. So when I read that article, I decided to duplicate the experiment that they did in 1948, and I tested it on about a dozen glaucoma patients, and indeed, it did help lower the intraocular pressure, about 5 millimeters of mercury. Only in those patients that were not taking eye drops. As soon as you're using eye drops, then the effect is minimal. Of course, we just measured the pressure-lowering effect, but I do think light therapy has all those physiological effects. So getting back to the sun, there's a therapy, and all of you will be having it on you today, called ultraviolet blood irradiation, where we actually take some blood out of your body and we pass it through a very powerful ultraviolet light and put it back into your body. So we're impregnating every hemoglobin molecule and putting it back in your body. So it's kind of like being on the beach and being in the sun for maybe a couple of weeks without getting the bad sunburn. So we'll be having that done, all of you. And the effect is very, very pronounced. Some doctors feel that the effect will last as long as 5 days. So it oxygenizes your blood, energizes your blood, and also what it does, it increases oxygen uptake. So, when a doctor examines you, he's always looking at your O2 sat. When you go into the emergency room, what's the O2 sat? And of course, if the O2 sat is high, 98, 99, you know that the blood is well oxygenated. But unfortunately, the amount of oxygen in the blood has nothing to do with your cell's ability to uptake the oxygen. So whenever we're in our 20s and 30s, our oxygen uptake is very high. But once we get over 60, over 70, oxygen uptake decreases. So even though our oxygen saturation is high, ultraviolet blood irradiation and ozone has been shown to reset the oxygen uptake, which is, we need oxygen for life and regeneration. So that's one of the benefits. It's resetting your oxygen uptake, which can be remarkable for helping your body to regenerate, also helping your body to establish better harmony, also helping your body to prevent it from further degeneration if you have glaucoma. So we'll have the ultraviolet blood irradiation. Now, I want to talk a little bit about sunlight, because sunlight has gotten a bad rep. I was taught in medical school in my ophthalmology training that the sun is dangerous, right? Everybody here agrees you have to avoid the sun. But one of the biggest deficiencies that is very prominent now, even the traditional doctors are recognizing this, is vitamin D deficiency. Everybody's vitamin D deficient. Why? We're not getting enough sunlight. We do need a moderate amount of sunlight. And of course that all depends on our skin color, where we're getting sun exposure. Here in Florida, where it's sea level, we have really high humidity, you can get more sun exposure. But when I lived in Arizona with 5% humidity at 2,000 feet, 10 minutes at the noon sun will badly burn your skin. So it all depends on your location and skin. But the bottom line is we need a moderate amount of sunlight. Now, all the eye doctors quote an article that was published in the American Journal of Ophthalmology showing the ill effects of ultraviolet light. So I'm going to tell you how the study was done, and you tell me if it was a good study. So they got a group of monkeys, and all the monkeys had cataract surgery. So the human lens acts as a filter to prevent an excessive amount of ultraviolet light going into your eye. So those of you that have cataract surgery, you lost that protective effect. So the monkeys had their lens removed. Next, the monkeys had dilating drops put in. You all know when you have dilating drops, your eyes are very sensitive to the sun. When you go outside in bright lights, your pupil can't constrict. So the eyes were dilated. Then the monkeys had a lid speculum placed in their eye, so they couldn't squint. Squinting is another way to protect your eyes. So they had the lens removed, dilating drops put in, a lid speculum, their head was strapped to a chair, and then they got a 10,000 watt xenon arc lamp and shined it into their eyes for 16 minutes. And at the end, they harvested the monkeys and they looked at the retina and they said, my goodness, ultraviolet light causes damage to the eye. So Professor Ott, who's a big advocate of the health benefits of ultraviolet light, stated, it's much like doing an experiment with humans, having them go into a blast furnace and they come out burned, and the conclusion is heat is bad for the body. So it wasn't a good experiment. So we do need ultraviolet light. There was also a study done at Wills Eye Hospital where they discovered that the rabbit retinal pigment epithelium will not regenerate without low levels of ultraviolet light. So we do need ultraviolet light. I mean, the sun is the source of all light. We need those electrons. We do need sunlight. But I really can't answer you how much sunlight do we need. And that depends on the individual. The important thing is do not get a burn. We do need moderate amounts of sunlight. Now, interestingly, in our eye, we have cones. Cone is the element that receives color. We have red cones, blue cones, and green cones. We also have cones that recognize and receive ultraviolet light. So why would God design our retina with cones that receive ultraviolet light if ultraviolet light is damaging to the eye? So there's many factors. So after doing all my research and studying, I wear sunglasses minimally. I used to be the kind of person I put my sunglasses on just to walk, outside for a couple of minutes. Now the only time I wear sunglasses is if I'm going to spend a day on the beach or, prolonged period outdoors. But we do need sunglasses. Now, if you've had cataract surgery and you have an artificial lens, then that's a different situation. You probably do need sunglasses because your eye does not have that protective effect. So we talked about the benefits of light. And, light is essential for our health and well-being. It's essential for the good nutrition in our food. We need those electrons. So embrace the light therapy. The light therapy is something that is really, really important as part of your program. Now, on one hand, light can also be toxic. Too much of anything can be damaging to your body. Too much water can be hazardous. Too much oxygen can be damaging. And the wrong light frequencies and the wrong wavelengths during certain times of the day can be harmful. There's a brilliant researcher, Professor Hayam, who I interviewed twice on my radio show out of Israel, and he investigated a condition called light at night. And more people are becoming familiar with this and recognizing it. He feels that certain wavelengths of light can be damaging at night. So he conducted an experiment where he got mice and he injected the mice with cancer cells. He studied diabetes, hypertension, cancer, obesity, various disorders. And one group of mice, he subjected them to a normal circadian rhythm. By that I mean light during the day, darkness at night. The second group of mice, what he did, he subjected them to light during the day and unwanted light at night. And at the end of the experiment, he discovered that the mice that got the unwanted light at night had an increased rate of growth of cancer, more eye problems, diabetes, obesity, degenerative disorders. So he discovered that light at night was harmful. So I thought it was a great experiment, but he didn't stop right there. He took it one step further. He wanted to find out what wavelength, what light frequency produced the greatest damage at night. So imagine this, he repeated the entire experiment using red light, yellow light, green light, blue light, purple light, all the different colors of light to see what was the culprit at night. So guess what wavelength, what color was the big culprit at night?
Blue.
Blue. Blue light. Which is kind of shocking because our federal government is now pushing compact fluorescence lights for us to use, and now fortunately we're able to find the incandescent lights now. Before you couldn't get the incandescent lights, now they're more readily available. The blue light is toxic at night, and unfortunately we are being exposed to more and more blue light at night. Watching TV, on our computers, on our cell phone. It's interesting, I have an iPhone, and there's something called a night shift on my iPhone. It's a blue light during the day, but at night it shifts to red. So the engineers at Apple are aware of this phenomena. And if you think of nature, we need blue light during the day. The sky is blue, the water is blue, but at night what happens? The sun sets, we have the red frequencies. So Professor Hayam feels that this is going to be one of the biggest health crises in our country because of unwanted exposure to blue light at night. And he feels that the increased incidence of breast cancer in our country is due to blue light at night. People are getting excessive amounts of blue light at night, watching TV, on our cell phone. There was a study done in China where they took a group of macular degeneration patients, and all they did was make them sleep in a totally dark room at night. And just doing that one step, a large percentage of them had an improvement of their vision. So your room should be totally black at night. Even the illumination of your alarm clock can affect your circadian rhythm. It doesn't matter if you have a sleep mask on, because we have photoreceptors on our skin. And if the light hits your skin, it's going to affect your circadian rhythm. So get the TV out of your bedroom. So I'm going to give you a demonstration about the toxic effects of light. This is a light noise detector. It measures nasty light frequency. So I'm going to show you. Let's see here. Right here. This here is the incandescent light. Just a very, very light hum. Nothing. Now, this is a compact fluorescent light. And this is a low wattage. I think this is a 60. Now, some people say, well, the LEDs are better. Well, in this office, all the fluorescent lights here were fluorescent. And I had an electrician come in to change them all to LEDs. I thought I was doing a favor, but LEDs are not good. Listen to that. And your cell phones. I'm not a salesperson for Apple. I do not own stock. But very, very noise. But if a Samsung phone or some of the other cell phones, you put it up here, you'll hear a lot of noise distortion. So my advice is that you do two things. Number one, look at your bedroom at night. Is it totally dark? Get those blackout drapes that they have at the hotel. Get rid of your alarm clock or any type of illumination in your bedroom. You should be sleeping in a totally dark room. Second, protect your eyes from blue light at night. Either eliminate night. I think the healthiest thing to do is to make sure. Doctors now are finding more and more that getting good sleep at night is probably one of the best things you can do. And a lot of you have told me that you have insomnia, you can't sleep at night, so we have to work on what you can do to help get a good night's sleep. But one thing is, eliminate the unwanted light in your bedroom. Tomorrow we're going to be talking about the hidden danger, and that's electromagnetic frequencies, dirty electricity, which is a whole topic I want to give a demonstration on, how we're surrounded by those electromagnetic waves. But also what you can do is, in terms of the blue light, there's something called blue blockers. You can get them at any drugstore or optical shop. The blue blockers are shooter's glasses. It's like an amber glass, and it eliminates the blue light wave. So you can put the blue blockers on when you're working on your computer at night. Or they even have like blue blockers screen for your computer. And now they have apps where you can actually shift the color of your computer to eliminate that blue light at night. But blue light is toxic to your eyes at night, and you do have to avoid it. And I do think that it may adversely affect your eye pressure too, excessive amounts of blue light.
What's the app for, you said where it changes your phone to red?
On the Apple,
There's one called Iris.
on the Apple phone, if you go to settings, display and brightness,
Oh, where it says dark? Or,
it's called night shift.
oh, right. Okay.
Night shift, display brightness, yeah, here. So my scheduled 10 p.m. to 5 a.m.
Oh.
I have the night shift. Now, a few years ago, I would tell patients, okay, you can do your light therapy anytime. But now I'm pretty concerned. You should not do your light therapy at night. So try to do your light therapy during the day. Of course, in the wintertime, the sun sets at 6 or 7. I think as long as you do the light therapy, before 8 o'clock, that would be okay. But don't do it right before you go to bed, because that's going to, your light therapy for your eye.
No, so why is that?
Well, because it's going to affect your circadian rhythm.
Okay.
You shouldn't have that light exposure. When the sun sets, you shouldn't have any undue light exposure. Mother Nature wants you to rest and avoid light exposure. Unfortunately, we're being bombarded by light. We're watching TV. How many of you have a TV in your bedroom? And you fall asleep watching TV. These things are really, really harmful to your eyes. Okay, so what we're going to do is we're going to get everybody set. We're going to do the ultraviolet blood irradiation. And then tomorrow we're going to be talking about the hidden danger electromagnetic frequencies, because there are good frequencies, like the microcurrent, the frequency of the Earth, and there are bad frequencies. And I think that's becoming more and more of a problem. So it's going to be an interesting talk tomorrow.